Hi everybody and welcome to my presentation. My name is Megan Mercado and we'll be talking about universal healthcare today. So to begin, I'll start by talking about what universal healthcare is. There are a lot of definitions out there and some people may be confused with what the United States has versus other countries, things like that. Then I was assigned the cons, so the negatives of the United States having universal healthcare, so we'll talk about that. And then finally, we'll wrap it up with possible solutions for the United States to have a universal healthcare. So first, the World Health Organization has an awesome video on YouTube that defines universal healthcare as everything that is involved in getting, being, and staying healthy. And I thought that this was really interesting because most people think of healthcare as just something that they use when they're sick or they're injured or things like that. But the World Health Organization described it as that, but also all the things that it requires people require to stay healthy. So just regular doctor visits, annual physicals, things like that. And then a Forbes article stated that universal healthcare is an agreement to provide available healthcare services to all citizens at an affordable rate. So I think that's the definition that most of us are familiar with. It's all about money and the government being able to subsidize some of those costs that patients associate with healthcare services. So in the United States, our current healthcare system are all things that involve like Obamacare, Medicare, Medicaid, any government subsidized programs for healthcare. So there are government-run programs and also private insurances. People can have both, people can have one or the other. There is a percentage of some people that have neither. It all depends on the person. Government, if they are in a government subsidized program, that's when the government pays most of the costs for the services. And so the reason why a lot of people don't like our current healthcare system is because the government pays most of the cost and our government doesn't have a lot of money. We're in debt. And then I found that the insurance and drug companies in the US won't lower any of their prices. So the government is paying a lot of money to try to subsidize these costs, and other companies aren't doing anything to try to lower their prices to help out the government. So the government is just spending more and more money for really not that great of healthcare to begin with. So that kind of goes right into our cons. With all my research, I kind of broke all of the cons I found into 4 main categories. So the main one that, like I said, I think everybody's familiar with are all of the monetary drawbacks associated with having universal healthcare. Next, another one I found was accessibility. Even if people have universal healthcare, are services accessible to them, things like that. And then representation of a good healthcare system. There aren't many. And then whether or not the United States needs a universal healthcare. So the first one is monetary. This article from the New England Journal of Medicine was really interesting, and it broke down, like many articles do, the United States healthcare system to Canada's. Canada is one that people compare us to a lot because for some reason they have found a very good healthcare system at little to no cost to their government. So people try to model it after them. And so this article compared that, and this was in the early 2000s, so I'm sure that the numbers have even skyrocketed since then. But the statistics in this article were that the United States is spending $294.3 billion annually on healthcare. And it went so far as to say, in quotes, that our current healthcare system is not worth the amount of money going into it. We're putting a lot of money into it, and it's not even that great. So much money that it is $1,059 per capita. So for every person living in the United States, compared to Canada's $307 per capita. So Canada is paying a third of the cost that the US is. And so you'd think, in theory, then that our healthcare would be 3 times better, right? But it's not. Another monetary reason why our healthcare isn't that great is because other people are losing money because they're not being paid for their services. So this was from an article from the American Economic Review. And so it's talking about physicians and hospitals and things like that, that when they perform a service, if somebody is covered by a government subsidized program, those physicians are not receiving the money that they would for somebody who is through a private insurance. And this one I actually have a lot of firsthand experience with because my dad is a podiatric surgeon, but he owns his own practice. So it's one of those things that he's really noticed since more government subsidized programs have been out the past couple of years, that for his patients that are on free healthcare programs, he doesn't see that money that he would a person on different insurance plans. And then an article from Forbes had a really interesting take on money spent on healthcare that seems so simplistic when you put it out there, but I never really thought about it because they stated that obviously the more money you spend on healthcare, the less money the government has to spend on other things. And so for our current president, if border defense is something that's really important to him, he'll want to put more money into that. So then there's not enough money towards healthcare. But we're putting in so much money into our healthcare that then there's not enough money for border defense. So you kind of have to pick and choose because our government doesn't have enough money for all of these things. And it's almost like our healthcare isn't even that great, so why bother putting money into it? Another really fascinating article was from the Journal of Acquired Immune Deficiency Syndrome, and he was talking about patients with AIDS that are trying to receive services. And so while this is a very small population that doesn't affect a lot of people, it was saying that services and treatments for AIDS are so expensive and timely and everything like that, that a lot of people don't even bother getting them because they don't have enough money. And then even the patients who do try to get them through government subsidized programs, it's still too expensive. So it's not enough for their universal health care to cover it. They still have to pay a good chunk out of pocket just because it's such an extreme service. So even with universal health care, they still can't afford things. So again, it's almost like, well, then why bother getting the health care? Next was representation, and this I thought was kind of negative, but the Lancet had an article that said there's no successful universal healthcare system in the world. So the article talked about how globally countries, kind of borrow and steal ideas and things like that. So the US should just kind of stop trying to figure out a good universal healthcare system, because once a country figures out a good one, then we can just steal that. We don't have to worry about trying to formulate our own good idea, so why bother? Forbes had a similar idea, saying that different countries are trying different universal healthcare frameworks to no avail because there is no universal solution to providing affordable healthcare to citizens. So if there's no solution, why even try to fix the problem is basically what they're saying. The last category of a negative for having universal healthcare in the United States was need. And this one is kind of similar to representation, but I just thought it was really interesting. The same Lancet article said that countries are constantly borrowing ideas and services, basically eliminating the need for universal healthcare. Because if we're already borrowing ideas from other people, we don't even need our own universal healthcare system. We can just borrow an idea from Canada, one from Australia, one from Great Britain, things like that to make our own. So we don't even need to worry about creating our own universal healthcare. So there's really no need for having our own idea, is basically what it was saying. However, like every good problem, there are some solutions to this. An article from Health Affairs basically stated that the best solution to universal healthcare is to implement an accessible and well-integrated primary care. So their main idea was that, yes, we should have a universal healthcare system. And even though I was assigned the concept, I personally agree. And then to kind of delve deeper into that, the New England Journal of Medicine, the one that compared monetary values between the US and Canada, said that the best framework to implement was Canada's healthcare system. And Canada's healthcare system is really interesting because it's kind of a mix between a lot of things. So yes, it's government subsidized, but then with some out-of-pocket expenses. And each individual person can kind of decide how much they want the government to subsidize and how much they are willing to pay out of pocket for services and prescription medications and things like that. So it's really kind of a mix between a lot of different ideas, and that's why a lot of people think it's really great. Another thing that I personally think is really cool about Canada's healthcare system is that they really strive to have low ambulance fees, which I think is awesome because I've never understood why if somebody needs emergency transportation, they have to pay for it, because what if somebody can't afford it, but they want to live? So another thing that would help our current healthcare system is to implement Canada's low ambulance fees as well. So to conclude, we talked about what universal healthcare is, what it looks like in the United States. We talked about a lot of cons associated with our universal healthcare system and decided that our current healthcare system really isn't working. It's just draining money from a lot of people and especially the government for no really good reason because we don't even have that great of a system. So why put money into it? But we concluded that it would be really great to have a universal healthcare system as long as it's kind of in the same frame as Canada's healthcare framework. So if we follow Canada's, I think we can have a really great healthcare system. So that was my presentation on universal healthcare, and thank you very much. Goodbye.